Hello. हेलो.
हेलो
यस
मैम.
मैम.
स्लाइड शो हो रही है आप लोगों को?
यस
यस
मैम.
मैम.
ठीक है. So today's lecture topic is about the nose and the paranasal sinuses. It starts from the first structure, that is the nose. The nose consists of two parts. The outer part is known as external nose, that you can easily see with the naked eye from the outside. That part of the nose known as the external nose, and inside there is a cavity known as nasal cavity. So there are two parts of the nose, the external nose and the nasal cavity. Both these parts are divided by a septum into two halves, the right and the left halves. So the first structure, that is the external nose, composed of, from above, the framework of the external nose consists of three bones. Mainly, it is formed by the nasal bones. Then there is a frontal processes of the maxilla, and there is also contribution from the nasal processes of the frontal bone. So three bones participate in the formation of the framework of the external nose from the superior aspect, the nasal bone, the part from the maxilla known as frontal processes of the maxilla, and this process of the frontal bone known as the nasal processes of the frontal bone. Inferiorly, the framework is formed by the plates of the hyaline cartilage. So there are two structures, a bony component and the cartilaginous component. Inferiorly, these are the plates of the hyaline cartilage, and superiorly, the framework is formed by three types of the bones, the nasal bones, the frontal processes of the maxilla, and the nasal processes of the frontal bone. Then the second main part known as the nasal cavity. The nasal cavity extends from anterior nasal aperture or nasal openings to the posterior nasal openings, also known as coni. The posterior nasal opening known as coni. So this is the extension of the each half of the nasal cavity. The nasal cavity extends from the anterior nasal aperture or nasal openings to the posterior nasal aperture. This posterior nasal aperture also known as coni. This coni is continuous with the nasopharynx. That is the part of the pharynx. The part of the just behind the anterior nasal opening, this area of the nasal cavity known as the vestibule, and this vestibular part of the nasal cavity is covered by the skin. That is a modified type of the skin, contains numerous hairs. This point we will discuss with the mucous membrane covering the nasal cavity. So first of all, the extension from the anterior nasal apertures to the posterior nasal apertures. Through the posterior nasal aperture or opening, the nasal cavity is continuous with the nasopharynx. The partition between the nasal cavity, which divides the nasal cavity into two equal halves, the right and the left halves, is by a nasal septum. This nasal septum is made up of three structures: anteriorly by the septal cartilage, posteriorly by the vertical plate or perpendicular plate of the ethmoid bone, and inferior posteriorly by another bone known as vomer. So these are the three structures which forms the septum. The nasal septum, which divides the nasal cavity into two halves. This nasal septum is formed by three structures: the septal cartilage, the perpendicular plate of the ethmoid bone, and the vomer. Now, by this septum, the nasal cavity is now divided into two halves, the right and the left half. Each half of the nasal cavity having four boundaries or four walls: a floor, a roof, the lateral wall, and the medial wall, that is also known as the septal wall. The floor of the nasal cavity is formed by two bones, the palatine process of the maxilla, and posteriorly by the horizontal plates of the palatine bones. This is the floor of the nasal cavity. This is the nasal cavity in which the septal wall is reflected. This is the lateral wall of the nose, and this one is the floor of the nasal cavity. That is actually the roof of the oral cavity. The floor of the nasal cavity is formed by these two bones, the palatine processes of the maxilla, and this one is the horizontal plate of the palatine bone. The roof is somewhat narrower as compared to the other walls, and this roof is formed by different structures, anteriorly by the nasal and the frontal bones, in the middle by the cribriform plate of the ethmoid, and posteriorly by the body of the sphenoid. See in this figure, this is the floor, and now this is the roof of the nasal cavity. The roof of the nasal cavity from anterior to posterior side is formed by anteriorly by the nasal bones. These are the nasal bones, and here is as a part of the frontal bone. In the middle by the cribriform plate of the ethmoid. This is the cribriform plate of the ethmoid bone, and posteriorly by the body of the sphenoid. That is the structures in the roof of the nasal cavity. The lateral wall of the nasal cavity is much important because there are numerous openings of the air sinuses, the paranasal sinuses in each of the three meatuses we will discuss in the lateral wall. The lateral wall of the nose contains three bony projections. It's not a smooth wall. It contains these bony projections. The bony projections in the lateral wall of the nose known as conchae. The conchae are the bony projections present in the lateral wall of the nose. There are three bony projections named accordingly: the superior nasal conchae, middle nasal conchae, and inferior nasal conchae. So the lateral wall of the nose contains three types of the projections. These are the bony projections. The superior and middle conchae are the projections of the ethmoid bone, while the inferior nasal conchae is a separate bone of the facial skeleton. Below each conchae or below each projection, there is a space, and this space is known as meatus. So like three projections, there are three spaces known as superior meatus, middle meatus, and inferior meatus. So below each projection, these spaces are known as meatuses. Below the superior conchae, this one is the superior meatus. Here there is a middle meatus, and this is space inferior to the inferior conchae known as inferior meatus. So lateral wall of nose, first of all, the first structures are conchae, defined as bony projection or prominences, superior, middle, and inferior conchae. Below each conchae, there are another type of the structure known as spaces, known as meatuses. So there are three meatuses: superior, middle, and inferior meatus. Another structure is also present in the lateral wall of the nose known as sphenoethmoidal recess. As its name indicates, it is related to two bones, the sphenoid bone and ethmoidal bone, and recess means a space. The space that lies above the superior conchae related to the sphenoid bone and ethmoid bone known as sphenoethmoidal recess. This recess above the superior conchae, this one is the superior conchae. Above this, there is a recess or a space known as sphenoethmoidal recess. ठीक है, तो स्ट्रक्चर्स क्या क्या होगा इसमें? Conchae, superior conchae, middle conchae, inferior conchae. Below each conchae, there is a space known as meatuses, superior meatus, middle meatus, and inferior meatus. Another recess or space is present superior to the superior conchae known as sphenoethmoidal recess. Now the structures that are openings that are related to these meatuses. The superior meatus lies below the superior conchae and receives the opening of the posterior ethmoidal sinuses. See in this figure, here superior to the superior conchae, this space is known as sphenoethmoidal recess in which the sphenoidal sinuses open. In the superior meatus, at this level, there is an opening for the posterior ethmoidal sinuses. Now the middle meatus is defined as it is a space that lies below the middle concha. In this middle meatus, there are certain structures, certain protrusions, or channels are present. First structure related to the middle meatus is a rounded swelling known as bulla ethmoidalis. This bulla ethmoidalis or protrusion or swelling is formed by the middle ethmoidal sinuses, which opens on its upper part. So the first structure in the middle meatus is a swelled part, the swelled structure known as bulla ethmoidalis. This is the swelling known as the bulla ethmoidalis in which the middle ear sinuses opens. Another structure is a curved opening, so it is known as hiatus semilunaris. It's a curved opening that lies just below the bulla ethmoidalis, known as hiatus semilunaris, in which there are openings for two paranasal sinuses, the maxillary sinus and frontal sinus. The third structure is known as infundibulum, related to the middle meatus. The infundibulum is a funnel-shaped channel that is present in the middle meatus and which opens the anterior ethmoidal sinuses. So in the middle meatus, there are three further structures: bulla ethmoidalis, that is a protruded part. Below the bulla ethmoidalis, there is a curved opening known as hiatus semilunaris, and there is a funnel-shaped channel in the anterior end of the hiatus semilunaris known as infundibulum. Related to these structures, there are openings for the few sinuses. The frontal sinus and maxillary sinus opens into through the hiatus semilunaris. The middle ethmoidal sinuses opens on the upper part of the bulla ethmoidalis, and the anterior ethmoidal sinuses opens into the infundibulum. ठीक है, अगर सिंपली आप इसे याद करें कि मिडल मियाटिस में कौन कौन से साइनसेस जो हैं वो ओपन हो रहे हैं, तो दीज आर frontal, maxillary, anterior, and middle ethmoidal sinuses. So the four sinuses opens into the middle meatus: frontal, maxillary, anterior ethmoidal, and middle ethmoidal. In the superior meatus, only the posterior ethmoidal sinuses opens. The third and the last meatus are the space that lies below the inferior concha known as inferior meatus. This inferior meatus receives the opening of the nasolacrimal duct that carries the tears from the lacrimal gland. So that is the structure of the lateral wall of the nose. Contains three projections: bony projections, superior concha, middle concha, inferior concha. Below each concha, there is a space known as meatus. So there are three spaces: superior meatus, inferior meatus, and middle meatus. Above the superior concha, another space is present known as sphenoethmoidal recess. Now, the medial wall of the nasal cavity is formed by the nasal septum that is already been discussed. That this nasal septum is composed of three structures: anteriorly by the septal cartilage, and on the posterior aspect by the vertical plate of the ethmoid bone and the vomer. Now, the mucous membrane of the nasal cavity, only the anterior part of the nasal cavity, that is known as the vestibule, this part, the vestibule of the nasal cavity is covered by the specialized type of the skin that contains the numerous hair. The remaining part of the nasal cavity is only covered by the mucous membrane. Now, there are two types of the mucous membrane. Above the superior concha, it is lined by olfactory type of the mucous membrane that contains the nerve endings that are sensitive for the reception of the smell. There is an origin of the olfactory nerve from the above the area of the superior concha. Second, the lower part of the nasal cavity is lined by the respiratory type of the mucous membrane or respiratory epithelium. So the nasal cavity is lined by two types of the mucous membrane. In its upper part by the olfactory type, which contains the olfactory cells, and there is an origin of the olfactory nerve for the reception of the smell. And the second, the lower part is covered by the respiratory type of the mucous membrane. Only the area of the vestibule is covered by the specialized type of the skin, which contains multiple hair follicles. The nerve supply of the nasal cavity Because of its different mucous membrane, there are two types of the nerve supply as well. The olfactory nerves from the olfactory mucous membrane are sensed through the cribriform plate of the ethmoid and goes towards and enters into the olfactory bulb. So this area is supplied by the olfactory nerve, the area superior to the superior concha. The remainder of the nasal cavity is supplied by the general sensory fibers, and these are the fibers of the ophthalmic division of the trigeminal in its anterior part and posteriorly by the branches of the maxillary nerve. So this part is supplied by the maxillary nerve. It's a branch of the trigeminal nerve, and the anterior part is supplied by the ophthalmic nerve, another branch of the trigeminal nerve. The blood supply of the nasal cavity, it's from the branches of the maxillary artery. Maxillary artery is a terminal branch of the external carotid artery. See in this figure, this is the external carotid artery, which divide into its two terminal branches. One of the terminal branches known as the maxillary artery. From the maxillary artery arises the sphenopalatine artery, that is an important branch supplied to the nasal cavity. This is sphenopalatine artery anastomosed with the septal branch of the superior labile artery. That is a branch of the facial artery. The facial artery itself is a branch of the external carotid artery. So the blood supply of the nose is actually by the 5 branches. These are sphenopalatine artery, branch of the maxillary artery. Another branch of the maxillary artery is a greater palatine artery. The branch of the facial artery known as superior labile artery. And these are the two branches of the ophthalmic division. That is a branch of internal carotid artery by the anterior and posterior ethmoidal arteries. So these are the 5 arteries supplying to the area of the nasal cavity on its lateral wall and medial wall. There is a difference on the branches on the lateral or medial wall that for the septal medial wall, there is a septal branch of the superior labile artery, and for the lateral wall of the nose, there is a lateral nasal branch of the facial artery. The remaining arteries are same. So collectively, there are 5 branches that supplies to the nasal cavity: anterior and posterior ethmoidal, sphenopalatine, greater palatine, and either the superior labile or the lateral septal branch or the lateral nasal branch of the facial artery. Now there is a rich anastomosis in between these 5 arteries, and the area at which there is an anastomosis of these branches, this area is known as Little's area, also known as Kesselbach's area. The Kesselbach's area or the Little's area is a site of anastomosis between these the branches of these 5 arteries that is present in the anterior part of the nasal cavity. The clinical significance of this Kesselbach's area is because there is a rich anastomosis between the branches of these arteries. So there is a slight injury or any changes in the temperature can lead to the bleeding from the nose, and this bleeding known as epistaxis. So epistaxis is a condition in which there is a bleeding from the nasal cavity from the Kesselbach's area, that is a network of the arteries in front of the nasal cavities and in the anterior part of the nose. And that area is actually a site of anastomosis between these 5 branches. That's why it is clinically important. Now, the lymphatic drainage of the nasal cavity, only the vestibular part, the anterior part of the nasal cavity is drained by the submandibular group of the lymph nodes. The remainder part of the nasal cavity is drained by the deep cervical group of the lymph nodes. Now the paranasal sinuses. The paranasal sinuses are air-filled cavities present in the interior part of the 4 bones. They are related to the maxilla, frontal bone, sphenoid bone, and ethmoid bone. So there are 4 types of the paranasal sinuses: the maxillary sinuses, frontal sinuses, sphenoidal sinus and ethmoidal sinuses. These sinuses are lined inside by the mucoperiosteum and they are filled with the air. These sinuses communicate with the nasal cavity through the smaller apertures or smaller openings that opens into the lateral wall of the nose. So these are the different sinuses. The frontal sinuses present in the frontal bone. These are the ethmoidal sinuses present in the ethmoidal bone and sphenoidal sinus, and anteriorly in the maxilla. These are the maxillary sinuses. They are lined with the mucoperiosteum. It means there is some mucus that is produced by the mucous membrane, and this mucus is moved into the nasal cavity, into the lateral wall of the nose by the ciliary action of the columnar cells present in the epithelium. The function of these paranasal sinuses, these are because they are the air-filled cavity, so their function is to act as resonators of the voice. Second function, they reduces the weight of the skull because they are only the air-filled cavities. When the aperture or openings of these sinuses are blocked or they become filled with fluid, the quality of the voice is markedly changed. Now, some of the related points to these sinuses. The first important sinus is a maxillary sinus that is present in the maxillary bone. It is a pyramidal shaped sinus is located in the body of the maxilla. See in this figure. The maxillary sinus lies in the maxillary bone, and it is a somewhat pyramidal shaped sinus. Its roof is formed by the floor of the orbit. This is the roof of the maxillary sinus that is formed by the floor of the orbit. So it is closely related to the orbital cavity. Its floor, the floor of the maxillary sinus, there are premolars and the molars teeth. The apex of the maxillary sinus extends towards the zygomatic bone and its base is usually towards the lateral wall of the nasal cavity. So this is here is the lateral wall of the nasal cavity. This is the base of the maxillary sinus and apex is towards the zygomatic bone. This sinus, the maxillary sinuses opens into the middle meatus through the hiatus semilunaris. For each sinus, you should know the location. Related structures or relations like the maxillary sinus is closely related to the orbit. So any infection or any injury to the maxillary sinus can lead to the infection of the orbital cavity. And second related point to the sinuses that where it opens into the hiatus semilunaris in the middle meatus. The second sinuses are known as frontal sinuses. There are two frontal sinuses that are present in the frontal bone. They are separated from each other by a bony septum. See in this figure, these are the two frontal air sinuses and they are separated from each other by the frontal septum, a bony septum. The frontal sinuses also opens into the middle meatus by the infundibulum, that is the channel through which it opens into the middle meatus. The third sinus is present in the sphenoidal bone known as sphenoidal sinuses. There are two sphenoidal sinuses lie within the body of the sphenoid bone and they opens into the sphenoethmoidal recess lies above the superior concha. So in the body of the sphenoid bone, here is the sphenoidal sinuses that opens into the sphenoethmoidal recess. The ethmoidal sinuses are three in number, the anterior, middle, and posterior ethmoidal sinuses. These are the ethmoidal cells or ethmoidal sinuses. They are divided into three types, the anterior, the middle one, and the posterior ethmoidal sinuses. These sinuses are located between the nose and the orbit. So if there is any infection of the ethmoidal sinuses, they can easily spread from the ethmoidal sinuses into the orbit. So that is also clinically related to the orbital cavity. So if there is any infection or injury to the ethmoidal sinuses because of its close relationship with the orbital cavity, these are the ethmoidal sinuses located between the nose and the orbital cavity. So from there, the infection easily transmit to the orbital cavity. These three sinuses opens through their respective openings. The anterior sinuses opens into the infundibulum and into the middle meatus. The middle ethmoidal sinuses opens into the middle meatus on or above the bulla ethmoidalis, and the posterior ethmoidal sinuses opens into the superior meatus. A clinical condition associated with the paranasal sinus is known as sinusitis. That is an inflammation or swelling of the mucosa of the sinuses. That is simply known as sinusitis, the inflammation of the any of the paranasal sinuses. That is usually associated with the infection of the nasal cavity. The flu may be transmitted through their mucous membrane, because the mucous membrane of the nasal cavity is continuous with the mucous membrane covering the sinuses. So because of their continuation and their openings into the lateral wall of the nose, the infection from the nasal cavity can transmit through these openings and enters into the paranasal sinuses, leading to sinusitis. From the sinusitis, the patient presents with the pain in the area of the sinuses. A clinical examination related to these sinuses known as transillumination of these sinuses. Usually we transilluminate or test these two sinuses, the maxillary sinus and the frontal sinus, because these two sinuses are like located superficially and you can easily identify any inflammation of these sinuses. But the two other sinuses like sphenoidal sinus and ethmoidal sinus, they are somewhat deeper located in the deeper bones. So they are not tested with the transillumination test. For the transillumination, that is usually performed in a dark room. We apply transmit a light source through a torch. For the maxillary sinus, that light source is on the side of the cheek, or the light is projected from the hard palate. Then we see there is a transillumination of the sinuses, and there is an formation of a bright globe of the light at the area of the sinus. For example, see in this figure, the area of the maxillary sinus. If there is any infection or inflammation, due to that, there is an accumulation of the fluid in these sinuses. So the glow of the light will be decreased. That helps in the identification of our diagnosis of the cases of the sinusitis. For the frontal sinuses transillumination, we project the light from the angle of the orbital cavity and then again see the glow of the light on the forehead at the area of the frontal sinuses. So that is a type of the test for identification or diagnosis of the any infection or inflammation or the cases of the sinusitis. Now, any question related to the topic, nose and the paranasal sinuses?